Hi guys, this is Dr. Heather Esquivel. I'm the Chief Medical Officer at Mission East Dallas. I figure probably the most relevant topic to what's going on locally, globally, but also just in the time of the year is to talk about the difference between the common cold, allergies, the flu, and COVID-19, because they sometimes share symptoms, and obviously around this time of the year, it's going to start to become somewhat confusing to the average person out there as to what are the symptoms I'm experiencing, what are they really about, what do I have to be worried about, and could it be something that's more concerning? So I wanted to start talking about what to really look for related to COVID-19. And you've probably seen a lot on TV, looked at a lot online, and there's really, a range of symptoms that go along with this as well. So you're going to hear about mild symptoms, and a lot of patients with mild symptoms being told to just hang out at home, quarantine for 14 days, and do some self-care at home, which is absolutely appropriate. But you might be confused about, well, when do I have to be worried? So the main symptoms related to COVID-19 that we're really concerned about are going to be fever, cough, and shortness of breath. So even in the mild stages, you might have some of that. But when we really start to think, someone needs to maybe get medical treatment, be thinking about going to the emergency room or the hospital, is when some of these symptoms are really just out of control. So we're talking about super high spiking fevers that are not going away despite taking some Tylenol or ibuprofen. We're talking about a cough that is persistent. So not just a random cough here or there, but probably going to be going on and on. Without much letting up over several days. In fact, there are reports as well about the cough being uncomfortable, being painful even. The cough for COVID-19 does generally tend to be a dry cough compared to a wet, phlegmy cough. So that's another thing that could help you distinguish what might be going on. And then the shortness of breath is important to pay attention to. So we're not talking about shortness of breath like after you climb a flight or two of stairs and you catch your breath within a short time. We're talking about really significant shortness of breath to where you feel like you cannot take in a good breath of air. There's a lot of reports about your chest feeling constricted, even feeling like there's a tightness or almost like someone giving you a bear hug around your chest to where you can't even expand your lungs very well. So those are the kinds of things to really look out for during the COVID-19 pandemic that would help you identify perhaps that that's what's going on. Certainly there's, no reason not to call your doctor and ask anyway, but those are the kinds of things to look at for possibly considering going to the emergency room or going to the hospital. There's another plethora of other sort of softer signs that are being reported with COVID-19, and that includes GI symptoms, so some diarrhea issues or upset stomach issues. There's been reports about the loss of the taste, the sense of taste or the sense of smell. Those things might go along with it. And you might even have some regular cold-like symptoms like a runny nose or congestion. So don't feel bad about being confused if several things are going on and you're just not quite sure what it might be. But certainly look out for some of those emergency signs to go to the hospital for. Otherwise, talk to your doctor about everything else that's going on. It's a good idea if you can really to be able to take your temperature during the midst of all of this. Knowing whether or not you have a low-grade temp versus a high-grade temp is pretty important in terms of figuring out if you might need to get tested. So keep that in mind if you're calling for some advice. So some of the things that can distinguish allergies from all of this are pretty classic and I think really easy to identify. We're smack in the middle of the spring season right now, so you're going to see and know a lot of people and possibly even yourself experience these symptoms. And there's tons you can do at home and with over-the-counter medications that can help you out. So with allergies, Generally speaking, you're going to have an allergic response that's going to trigger a couple things. So sneezing is really common with allergies, and itchiness. So itching, feeling anywhere. People will complain anything from itchy eyes, feeling like the insides of my ears are itchy, my nose is itchy, my throat feels itchy or tickly, and maybe even my skin. When pollen hits the skin, it's going to make you feel itchy. No infectious cause of symptoms like this is going to really occur. A common cold, COVID, a sinus infection, the flu, really not going to give you symptoms that make you have this sense of itch or a lot of sneezing going on. So that's one of the classic things to look out for. The other thing is to think about duration. So allergies tend to be slowly developing over days and weeks, and they'll go on and on and on if you don't do anything about them, if you're not taking anything to help calm it down. Compared to an infectious cause like a common cold, sinus infection, COVID, those things are going to tend to be develop fairly quickly over the course of usually a few days. And without treatment will get significantly worse over the course of a few days. So allergies are really just going to draw themselves out. This is when I have patients coming and saying, man, I've been stuffy, sneezy, and having a runny nose for like 3-4 weeks. What's going on? That's much more common with allergies. So to go on to the other symptoms, of course, really anything in the head is possibly going to get affected with allergies. So you can have the runny nose, you can have congestion. The difference though here is that allergies are generally going to have you with drainage that is clear. Once you get into yellowish, you might have a common cold. Once you get into thick and green, then we're talking about possibly a sinus infection. Congestion can absolutely occur with allergies. Although again, the severity is important. So just feeling kind of, stuffy all the time or for the most part of the day for days on end is typically going to be from allergies. When you start to feel more mounting congestion, a lot more pressure in the face across where our sinuses are, that's across your cheeks, behind your nose, and like across your forehead. If that really starts to mount with a lot of pressure, a lot of discomfort, maybe even headaches, or actual feeling like there's pain involved, then we're really probably talking about more of an infection cause at that point. Your eyes could be itchy, watery. Again, the drainage there is mostly going to be clear. You can even get a pink eye from allergies, and this can be confusing because for the most part, I think most people figure a pink eye means it's infection, I need antibiotics. That's not necessarily the case. So there is such a thing as an allergic pink eye, or what we call conjunctivitis. So yes, you can have the pink going around the white of the eyes. You're going to tend to be itchy with that though, and have a lot of watery drainage going along with that when it's allergies. We worry about bacterial infection when the drainage starts to get yellow or green and goopy. Bacteria also tends to cause the redness to be more of a bright red. And there's also viral causes of conjunctivitis too. So can be confusing, but best to have your doctor check it out if you're going into the yellow, green, goopy drainage versus clear, watery, that may be more related to allergies or maybe even a virus. Other than that, you can definitely get drainage going down the back of the throat. I think that's the thing most patients tend to be confused about when they come to my office. Well, I have a scratchy throat or I'm coughing. They don't quite understand how that can be because of allergies. But the way our body works is that when we're breathing in allergens, our sinuses don't like it. They react by swelling and they react by draining. So drainage can come out the front, but it can also go down the back. So when it's dripping down the back of your throat, you have fluid going down the back of your throat on a regular basis. It can irritate your throat, cause you to have an itchy, scratchy throat. And as it's dripping, it can actually trigger you to cough as well. Our body is trying to keep that liquid from going down into the lungs, so we kick it out with a cough. So generally speaking, the cough tends to be dry if you're just having a little bit of drainage, but it can definitely get phlegmy if you're collecting a lot of this postnasal drip down in your throat. So don't be surprised with allergies. If you're clearing your throat a lot, feeling like you have to cough up some stuff in the morning, or you're kind of clearing and coughing phlegmy stuff out of your throat, that's pretty common with allergies as well. Then we get into like the lung things that allergies can trigger. So if you have a background of asthma, allergies can absolutely trigger your asthma. You're breathing in this pollen or grass in the spring season. I'm sorry, grass in the summer season. You're breathing this stuff in, it's getting down into your airways, and it can trigger asthma attacks or asthma-like attacks. Some people don't have full-blown asthma on a daily basis, but they get asthma-like problems when they get triggered by the allergies that are out there. So look out for that for sure. If you're starting to have some breathing issues, if you hear yourself wheezing, which is like a squeaky sort of noise when you're inhaling or exhaling, those are the kinds of things that might be a clue that you're having some lung problems going along with allergies. That's pretty common. So I already talked about, you know, how some of this can turn itself into looking like the common cold. So the common cold is generally going to have you with some fevers, allergies. You really should not be getting fevers with allergies. For the common cold though, you know, we're generally talking about some low grade temps, like in the 99 range, maybe the low 100s. And common colds are not going to go on forever. Like I said, allergies can. The common cold is generally going to do its business between 5 to 7 days. And the common cold is from a virus. It is not from bacteria. So if you want to call up your doctor at day 2 or 3 thinking you have a cold and want some antibiotics, that's not going to work for you. It does absolutely nothing. So the viral cold is going to do its business, usually slowly on day 1, 2, maybe 3. The worst of the symptoms tend to happen around day 4, and then slowly those symptoms are going to fall off by day 5 to 7. And you're not going to feel great. A lot of people figure, well, I feel just horrible. How could this be a regular cold? But it absolutely can make you feel horrible. You know, you can have some mild body aches, some mild fatigue, some mild fever. You can certainly have a cough and congestion, but generally speaking, a common cold is going to stay in that mild to moderate zone. When you're getting into severe symptoms or prolonged, so talking about past day 7 into day 10 or so, then we start thinking about whether or not you might have a sinus infection developing because of how long it's been going on. I think that's another point to make. A lot of people think by day 2 or 3 of being sick, I must have a sinus infection. Generally speaking, that is not the case. Bacteria takes several days to grow, and so it's not going to just happen like that out of nowhere. Usually it's going to take 5 to 7 days of being sick and significantly sick before we even really start thinking about bacterial growth and possibly dealing with a sinus infection. The last thing I wanted to mention is the flu. So we figure, oh gosh, it's spring, why are we even thinking about the flu anymore? But truly, the flu season can go all the way through May. Typically the peak is going to be in the wintertime, but we absolutely still see cases during this time of year. In our own clinic, we've seen them as recent as March and April. So you have to be looking out for that too. The difference with the flu, hey, you can get any and all of these symptoms I already talked about, but the difference with the flu is you're more likely going to have slightly higher fevers going on and a lot of just general body aches that are significant. So feeling like you abruptly out of nowhere got knocked out with something, feeling like your body, your muscles are achy, your bones hurt, maybe even having chills and sweats that just came out of nowhere. Those are some sort of red flag signs that maybe you're dealing with the flu. So I kind of wanted to cover all that because I know it's super confusing during this time of year to figure out what might be going on. Then the next step is what can you do? So right now, obviously, we're being told to, stay at home as much as possible, try to limit your activity out of the house. And to some extent, that does include the doctor's office. We, want people to be able to do things at home if possible. Certainly, we're here for you if need be, but there's a lot you can do at home for these symptoms that I think not everyone realizes all the time. So I wanted to go over that a little bit, and so that you can kind of think about some things you can do on your own. So since we're in the middle of allergy season, one of the things you do have to consider is trying to avoid the allergens that are outside. So I know that's kind of a bummer now, given that we do have to spend so much of our time inside, and you probably want to go for a walk or a run or have some playtime outside with your kids. So absolutely, you want to try to do that, but please be aware that when you're exposing yourself to more pollen, which is the biggest thing right now outside, tree pollen, is the most common thing you're going to encounter in the spring, you're also putting yourself at more risk for having some of these symptoms pop up. So think about that. Some of the times a day actually that are better to go outside and avoid allergy issues is early in the morning or late in the afternoon or evening. There's usually less active allergens floating around outside during that time. So best to do that if you want to be spending any time outdoors. The other thing to think about is your windows. If you're opening up your windows, well, we're essentially doing the same thing. We're letting the pollen come in the home, and you're going to have your symptoms of allergies act up as well. So think about that to try to prevent those issues. If you do have, central air conditioning, think about maybe some air filters that might be of use. There's air filters out there that are specifically for allergens to try to prevent that from being just recirculated around the home. That's another problem that might be occurring if you have some pollen that's already inside your house. The other thing is thinking about coming indoors. As I mentioned, if pollen gets on your skin, you might feel itchy. You might have to think about coming in, showering, washing, parts of the body that might have had some pollen get on it. If you are commonly wearing something outdoors, like a jacket or a hat, need to think about washing those things on a more frequent basis to get the pollen literally out of the fibers of the clothing. Otherwise, you're going to be inhaling it. It's going to be on you. Same goes for your kids. So it might just be making these symptoms go on and on without letting up at all. So those are some things that might be a clue as to why you're never quite feeling better. So as far as things you can pick up at the store for any of the symptoms we talked about, there's really a group of oral medications and nasal medications. And I know it's really confusing sometimes to figure out what the difference. So I'm going to go over that a little bit. So when we're talking about oral medications or pills, we're really talking about a group of medicines called antihistamines and a group of medicines called decongestants. So antihistamines are going to be like Claritin, Zyrtec, Allegra. Those are really going to be anti-allergy medications. They're going to calm down the allergy response and help to shut down, sneezing, runny nose, itching, even watery eyes. Kind of helps. I think of it as getting into your bloodstream and really helping everything if you're having multiple symptoms everywhere. A decongestant really says what it does. It decongests you. So you shouldn't really be taking a decongestion just for some watery, drainage of the eye, some runny nose. You really should be waiting to utilize something like that until you feel super stuffy, super congested in the sinuses to the point where you're feeling uncomfortable. Because generally speaking, decongestants are not recommended for long term. And they can actually cause higher blood pressure levels in people who have hypertension if you're struggling with that. So whenever people are saying, oh, I'm scared to take anything for a cold because I have high blood pressure, that is the medication we're talking about. We're talking about decongestants is what you should be trying to avoid. And typically speaking, on the shelf, the medication that really is a decongestant is Sudafed. There's a regular Sudafed behind the counter at the pharmacy, and then there's Sudafed PE, which is going to be on the counter that you can pick up yourself. The difference there is the strength. The one up at the pharmacy counter is much stronger. The one on the regular counter for you to pick up on your own is a sort of milder, gentler decongestant. Moving on to nasal sprays. So everything I just mentioned can also become in a spray. So a decongestant can come in a spray. Generally, the brand name, for instance, you might see there is Afrin, and then there'll usually be some generics in the same section of the pharmacy for decongestant. Again, please do not use these on a regular daily basis for weeks on end. Certainly can cause some problems of what we call rebound congestion. Essentially, the idea is your sinuses get so used to the medication that when you try to put it away, you just get slapped with an even worse congestion issue. So you really should be using an Afrin-like substance for only really severe congestion and for a limited time, pretty much no more than about a week. Then we get into nasal steroids and nasal antihistamines. So they actually are taking some of the prescription nasal antihistamines and putting them on the shelf now. So you may see something like that. I believe the one that's on the shelf or coming to the shelf is Patinase or Patinol. And then that's going to work exactly like a Claritin or a Zyrtec. It's going to help calm down allergy symptoms, but you're administering it through the nasal tissues. So, generally speaking, that will be a good one if you're just suffering with some nasal symptoms, or maybe even eye symptoms, because it does get absorbed into those nearby tissues. A nasal steroid is a little different. Steroids in general are going to help with inflammation. They're going to help with swelling. So those typically on the shelf are going to be something like Flonase, Nasacort, Rhinocort, or any of the generics that come along with those. Again, generally speaking, can help with any allergy symptom, but much more significantly with sinus and nasal symptoms that you might be experiencing. I also get asked, well, how do I pick which one is best? Do I need more than one thing? Truthfully, there is no one that is better than the other. All of these things are typically, in the same drug category. So unfortunately, I can't tell you the best antihistamine or the best nasal steroid. But the fact is, you might have to play around with these. You might have to try a couple things out before you really find the one that works for you. And sometimes you might have to take more than one medication. If you have some mild improvement from, let's say, an antihistamine pill, but you really would like to feel a little bit better, you might need to add a nasal steroid in addition to that to really get your symptoms under control. So don't be concerned if you feel like one medication isn't quite enough. You might end up needing two, depending on the severity of your allergies. Generally speaking, someone with mild allergies will do just fine with just one product, but moderate to severe allergies, in all likelihood, you're going to need two products. And then the other thing, obviously, is eye drops. So there is medication specifically to do for allergy drops. There's a variety of those on the shelf as well. We don't need prescriptions for those. And again, they're just obviously more targeted toward the itchy, the watery eyes. So if you feel like you need to add that on top of something else, you absolutely can do that. The last thing I'm going to talk about, which I actually recommend quite a bit, I use it myself, and it's a nice home remedy you can do, is called nasal irrigation. You might also hear of it as saline rinsing or nasal rinsing. The idea is that you are essentially flushing out your sinuses of the allergens and the goop that might be stuck up in there to help open up your nasal passages. And you might see commercials on TV about that. The common brand name thing you see is called the neti pot. Comes in something that looks like a little teapot or a little a squeeze bottle type of thing. You can do this at home. You don't necessarily have to go out and buy these products. If you have a squeeze bottle at home that you can fashion for this, that's perfectly fine. You can make your own home solution of saline. So you want a very sort of weak, salty water. I tell people, if it's salty like the ocean, you're not going to want to put that up your nose. It needs to be sort of a weak saline solution. You do want to be careful about the water source. So if you're not so sure about the water coming out of your tap, I would suggest using distilled water. There have been reports of people actually using dirty water, essentially putting it up the sinuses to clear it, and now they have infection because of the dirty water. So definitely be careful with your water source, but rinsing your sinuses out literally from side to side a couple times a week can definitely open up your nasal passages, help you breathe a lot better. Typically if the season is bad and really bothering you, I would suggest doing it at least 2 or 3 times a week. You can absolutely do this during a common cold as well, or even a sinus infection, to be honest. It's really just about trying to clear out your passages, help you breathe better, help you be more comfortable in terms of the discomfort that can happen with all that congestion that comes with some of those issues. So that's about it. That's my spiel on allergies and the common cold and the difference between some of the more concerning infections that I know you guys are all worried about at this time. So feel free to call us if you have questions. We do, lots of advice giving over the phone these days too. And because of COVID-19, we are implementing some televisits. So that's something important for you guys to know in case you're concerned about coming to the office. You can definitely inquire about that. So I'm going to sign off. Hope that was helpful to you guys, and I'll see you next time.